In a 6-3 decision, the Supreme Court ruled the health care subsidies offered by the Affordable Care Act, commonly known as Obamacare, may be offered to those who apply through the federal exchange as well as the state exchanges. Here now to provide us with some of the reasoning behind that and the implications of the landmark ruling is Joe Schember, certified financial planner and relationship manager with PNC Wealth Management. Joe, always a pleasure. Welcome back.
Thanks, Sean.
Okay, what is the issue that the High Court was addressing, specifically when they made their ruling?
Well, a goal of the Affordable Care Act is to provide more Americans with access to affordable health care. One of the ways the Act attempts to make health care affordable is through federal subsidies that reduce insurance premiums and out-of-pocket costs for eligible consumers who purchase health insurance through a health insurance exchange. At issue is a specific provision of the Affordable Care Act authorizing subsidies for health care coverage purchased, and I quote from the Act, through an exchange established by the state.
And that was the key. That was the key wording in all of this. Why was this an issue? And what did the Supreme Court, ultimately decide here?
Well, the IRS had interpreted the law to include subsidies for health insurance purchased through either state-based exchanges or the federal exchange. The petitioners contended that a literal reading of the Affordable Care Act only allowed subsidies for coverage obtained through an exchange established by a state. The court ruled that such a literal reading would obviate the clear intent of this law, which is to expand health care insurance markets to include people who cannot otherwise afford or obtain coverage. Citing studies that suggested that eliminating the tax credits could lead to insurance premiums increasing by as much as 47%, while enrollment might be decreased by upwards of 70%, Chief Justice Roberts opined that it is implausible that Congress meant the act to operate in this manner.
Okay, just a few seconds left, but what's the impact here? Bottom line it for us.
Well, 16 states and the District of Columbia operate their own state-based exchanges. These include California, Colorado, Connecticut, Hawaii, Idaho, Kentucky, Maryland, Massachusetts, Minnesota, Nevada, New Mexico, New York, Oregon, Rhode Island, Vermont, and Washington. The federal government operates exchanges in the remaining 34 states. Most consumers access the federal exchanges through the federal government website. According to the Wall Street Journal, more than 6 million people would have lost their health insurance tax credits if the court ruled against the Affordable Care Act. As of March 15th, the Department of Health and Human Services estimates that 16.4 million Americans have health insurance due to the Affordable Care Act.
Okay, so breaking down some pretty complicated language from the Supreme Court. Joe Schember, always a pleasure. We'll talk to you soon, sir.
Thank you.